A very good day to all my viewers. I am Dr. Amit Bhargava. I am a senior consultant medical oncologist at Fortis Hospital, Vasant, Kunj and Faridabad. I had been in oncology for more than 25 years now, and I had been treating patients in our country across all caste, creed, financial status, rich, poor, belonging to affluent society, belonging to very poor society. Now, today something struck me, and that's why I'm making this video, that what India needs and what are the problems that India has while, dealing with cancer patients. Number one, the number of cancer patients, depending upon the population, is too huge. And moreover, we need more and more facilities and to diagnose these cancers and to treat these cancers. So if you see in our country, the difference between tier 1, tier 2 and tier 3 cities, the availability of facilities, there is a big difference. If you see places like Delhi, Mumbai, Kolkata, Hyderabad and Bangalore and Chennai, you do get state-of-the-art facilities at these centers where rich and affluent people or people staying in the metropolitan cities can access to these facilities very easily. But somebody who is staying in a remote area, like for example, I would say Jharkhand or Uttarakhand or any of these interior states or tier 3 cities of our country, for them, number one, there is no awareness for cancer. Number two, even if they know that they have a cancer, they have to travel miles and miles of distance to get it diagnosed and treated. And as we all know, cancer treatment is not a one-day treatment. It goes on for almost 4 to 5 months, maybe longer. So for that period of time, for someone to travel so much of distance, staying away from home and getting treated for cancer is again a problem. So we need facilities, number one, at tier 2 and tier 3 cities. So my suggestion is that the focus of coming up of cancer centers now should be tier 2 and tier 3 cities rather than opening up new cancer centers at metropolitan cities, because most of these cities are now saturated with cancer centers. The other problem that we face in our country is finances. We do have such a big discrepancy in our country between the rich and poor. People who are rich, they are filthy rich, they can practically afford anything on this planet, and people who are poor, they don't even have money for having 3 meals a day. So someone who doesn't have money to deal with this kind of a situation, how do we give him state-of-the-art treatment for a cancer which still comes under curative perspective? So that is one of the biggest issue, and that is where we use cheaper drugs. We need cheaper cancer centers where they do not have that kind of an ambience which can increase the cost of treatment. We need low cost cancer centers. We need more of refurbished radiotherapy machines. We need most of low cost OTs where we can perform surgeries and give them radiotherapy at a very reasonable cost. We need some kind of a subsidy on cancer medicines for patients who have, who are, say, below a particular financial aspect. So their finances, the drugs should be available to them as per their financial details. So these are certain things that what I look that, which can bridge the gap between the cancer care for rich and poor. It's my dream to have a cancer care center where I can treat the rich and the poor with more or less similar kind of treatment and give them state-of-the-art treatment to everyone, and have diagnostics and therapeutics at a very reasonable cost where each and every Indian, despite of their caste, creed or financial status, should have an access to these kind of cancer treatment, because cancer, if treated on time, is still curable disease, and we can give them a very good outcome of cancer.